So when we really think about the times we're in, I don't know if any of you folks remember the social revolution of the 60s, but we're kind of going through like that right now with software. Over the last 10 years or so, we've been going through the medical software, and now it's our time. It's dental software's time. So there's a lot of dramatic changes in the dental software industry. And it's funny looking back here. It looks like it's about 6 years ago that I wrote a little piece for Dr. Bicuspid, actually, and I had been working in medical EHRs for a number of years and saw the evolution of electronic health records in medicine, and I kind of realized that this same thing was starting to take place in dentistry. So there were a lot of things that were starting to happen with dental software and with dental electronic health records, and actually one of the very first things that's really starting to happen that's changing the industry dramatically is the incorporation of e-prescribing in dentistry. In fact, I was very excited about it, and I wrote this piece, as Andy mentioned. I'm the electronic health records editor for Dental Products Report, and I wrote a piece that's really interesting if you get a chance, kind of going over why it's important, some of the vendors, some of the benefits, and it really struck me and very exciting that this is happening in dentistry. So as you probably know, especially some of you providers that are on this conference that are from New York State, a little while ago, actually it's been about, I think it was 2013, that they actually announced that in March 27th of this year, there would be mandatory e-prescribing, and this is a little piece from the New York Dental Association. But this isn't just dentistry, right? As you know, this is medicine, this is dentistry, this is really any provider that actually prescribes medications are mandated in the state of New York to be compliant by March 27, 2015. So obviously, especially in the dental industry where we don't see a lot of electronic health records and a lot of e-prescribing, this was a concern. So really, a lot of folks, a lot of colleagues of mine, a lot of business associates, a lot of clients, and people I get calls from every day because of Dental Products Report and Dental Software Advisor. A lot of confusion, a lot of questions, especially from the New York dentists. What are we going to do? There's this mandate. I'm not ready for it. How do I deal with it? Well, there was a simple solution that New York did. And what they did was they actually got the governor to extend it another year. So basically, what New York State has done with mandated electronic prescribing is not to say we will not do it, we will not mandate it, they're still mandating it, but they've kind of kicked the can down the road a little bit for a year. Okay, and there's a lot of reasons why they said they did it, but when I really looked at it and really looked at the reasons, I actually wrote a little bit of a rebuttal. And so I went back to Dental Products Report and wrote an article about, do we really need an extension on the New York e-prescribing mandate? And the whole point of this article was that even in spite of the mandate, even if you don't care about the mandate, if you're in California or not in New York, or you're in another state that doesn't have mandated e-prescribing, well, you know what? There's a lot of reasons why you want to do e-prescribing to be attested to by the last few years that the physicians have used it, medical practices, and the advantages and benefits. So really, let's kind of focus on that a little bit. Okay, one of the things, and we're going to go over this in detail, there's three main things you get from e-prescribing that have been proven over the last few years in practices and with patients. Improving patient care, more streamlined workflow, and a big one that everybody's interested in is reducing your risk. And we're going to talk about all the reasons why electronic prescribing supports this. And of course, we have the looming state mandates. And the reason I mentioned state mandates, and not just New York, is because I believe, and a lot of other folks believe, that the New York mandate is just a tip of the iceberg. Okay, there's a lot of reasons why states will mandate it. So even if you're not in New York, in the future you'll probably get a state mandate. But again, what this is about is to really talk about why e-prescribing is important to you as a provider and to your practice. So really, there's a lot of confusion. I'm a techie at heart, so if I get too geeky, just stop me. But I think it's really important. It's very important to really understand how this all works. Okay, you have in the center of this whole e-prescribing system in the United States this company called SureScripts. And just like you have a clearinghouse for your claims, they're basically a clearinghouse for prescriptions electronically. You have people hooked into this. You have the pharmacies on one hand. You have the PBMs on the other hand. And the area that you're going to be most concerned with is how does this information get into the system and how do we get information out of the system? Okay, so we have these various things, and this can be very confusing. And I'll tell you it's really interesting because I've been involved with ePrescribing for a good number of years, and the pharmacies, especially the small ones, really weren't ready for it. But now a lot of people have toed the mark. So the way this works basically is that there are ePrescribing companies. I have a few of them here, a few of the major ones. And what they do is they're responsible to provide the on-ramp onto this network. Okay, and then you have companies in our industry, in the dental industry, companies like Curve and Shine and Plan DDS, MacPractice, QSI, host of others that actually partner, because for the dental software companies to actually try to get on this themselves, it takes a lot of technical expertise just with this network. So actually it's a lot better to partner with these companies. Okay, and here's an example, like Curve, for example, works with Dr. First, Allscripts works with Shine, and this goes on and on and on. You're seeing more companies that are working with these electronic health record companies to get on to the SureScripts network and also have functionality for ePrescribing. So here's just a few press releases. For example, Planet DDS does DoseSpot, MacPractice does New Crop, and Curve does Dr. First. So every vendor has their own reasons why they've chosen ePrescribing company. Now, there's a lot of different ways that you can deploy ePrescribing as a provider, as a practice. One is what I call a standalone version. So basically you have a web application, you just go in, you type in your script, you get information. So everything's done through the web. It's not done through your software. That's a low-hanging fruit. That's one way to do it. However, the most popular way today, and the way to really get the most benefit out of it, is to incorporate it in your workflow. And that's what you're going to see, and that's what we're going to talk about. So a number of dental software vendors, as I mentioned, have partnered with these ePrescribing companies to provide integration. So basically, let's use an example of how this works. Okay. So for example, here you have an odontogram. And if you look on the right, this says launch Arcopia. In this case, Arcopia is Dr. First's electronic prescribing solution. Now, the benefit of doing it this way, of not doing the standalone version, but doing it this way, is that now all the demographics, all the patient information that you have goes over to this Arcopia, the Dr. First application. So you don't have to retype things in. Okay, if you do it as a standalone version, and you actually had Dr. First sitting on the side somewhere, you would have to re-enter information in that, the same information you have to enter in your dental software. The workflow would be terrible. Okay, so really what we're seeing is we're seeing people going more towards this integration of the prescribing systems with the dental software. Now finally, the Holy Grail, and we're not there yet, but it will happen in the future, is instead of actually linking to an ePrescribing system, a Dr. First, an Allscripts, a DoseSpot, what the dental software vendors will be doing in the future is actually incorporating the functionality totally within the software. I mean, you see that commonly in the medical world these days, and you're going to start seeing it in the dental world as people start using ePrescribing more. So this, again, is what I perceive to be the Holy Grail. That's a perfect workflow because everything's in there. We're not quite there yet, but we're starting to see that happen. So going back to my original discussion of why are we doing this, forgetting about the mandates themselves, why is this important to you as a provider, as a practice? There are a number of reasons that, and we're going to show you a little bit of detail. Well, you actually have templated medication prescribing, what is more commonly known as order entry. You can actually enter your scripts electronically, and we'll go over how to do that. You have alerts, interactions, drug allergy interactions. Very important, obviously. A concept that a lot of people haven't really heard about, but it's called decision support. Again, they use this a lot in medicine and medical EHRs. You're starting to see it more in dentistry. But to be able to get dental-specific information about the drugs at your fingertips that you're prescribing, that's very important. The ability to do consolidated medication lists. So we have the ability through the ePrescribing system to see all the meds that a patient has been on over the past 2 years, no matter where they've been, the hospital, nursing home, primary care doctor, general dentist specialist. You can see all this information. I'm going to show you something really exciting, really unique, and it's just starting to happen, called patient compliance monitoring, which is the ability to find out when a patient picks up their meds. And then finally we'll go into reports. So we're going to look at a few things here. And I hope at the end of this you'll really see why it's important for you to really start thinking about using this technology. So let's talk about the first one. A lot of different terms for it. Template of medication prescribing is what I call it. But think about all the errors that take place and the hassle and the bad workflow, just writing scripts up, giving it to the patient, sending it. Well, now we have the ability with ePrescribing. If you see here, we have a template. So what happens is you choose a pharmacy, and this is just an example of, in this case it's Dr. First, but this is just an example of an ePrescribing solution and what you would see. So here you see all these drop-down fields, and basically you pick and choose your dosages, you pick and choose your medications, you pick and choose your pharmacies. Okay, and what's really interesting is we don't have diagnosis yet that we use in dental software and dental EHRs, but it's coming. That's, of course, another matter and another conversation we'll have at some point. But you do have the ability to put in a primary diagnostic code and a secondary diagnostic code within your script. Okay, you also have the ability, and this is really cool, okay, and this goes with looking at the different EHR vendors and seeing what they have to offer. Here you're able to put in your favorites. So this is really nice because obviously as dentists you don't prescribe quite the number of drugs that, let's say, a primary care physician would do. So you might just have your favorites on here. So you have this ability. So you can see it's templated. It's really easy to pick and choose your prescriptions and send it on. The other thing, we don't have this enabled here, but if we did have the insurance companies hooked into the ePrescribing system, it would also tell you what's on and off formulary. The other thing that's really interesting and a little bit different is when you go ahead, we have the ability now, we didn't used to, when I started doing ePrescribing and getting involved, 5, 6 years ago, we didn't have the ability to control substances, but now we do. Okay, and in fact, that is one of the impetus why I think they're making the mandate of ePrescribing, why states are doing it, to have better control, better workflow for controlled substances. But anyway, the way this would work is if you prescribed a med, and let's say it was a controlled substance, there would be a little bit extra you would have to do. Okay, if you look down here, you have to sign in. There's a passcode you have, and this can get complicated, or simple. So I'll make it very simple. You put in a passcode, and then you enter a PIN from a device. And here we have examples of these devices. Okay, so these are devices that you might carry around, and what they do is they change. Their codes, their PIN numbers change every 5, 10, 20 seconds, every minute. Okay, so that's the way we have security for prescribing of controlled substances, by putting in passwords, by putting in PINs from these devices. So that's how they figured it out, and it's becoming very common, and now every ePrescribing solution has the ability to do controlled substances. Another really powerful feature are alerts, and this goes to the liability of the whole thing, and think about it. Okay, here we go, a drug interaction alert. How can you do this manually? You're giving 2 different drugs and they interact with each other. How powerful is this? And here are some other alerts. Okay, you're able to put in allergies within the system, and in this case, it shows allergy alerts, duplicate therapy alerts, dose check alerts. How powerful is this when you're ePrescribing, that you're able to get alerts for different interactions? Very powerful, and this is something we haven't had before, the concept of ePrescribing. Now, I talked a little bit about this concept of called decision support. So imagine that you're prescribing a medication, and all of a sudden it links to the Lexicomp database. Lexicomp, as you know, you've heard of them. They're really big in the industry in terms of having dentistry content. And here you can go and find out information. You can find out monographs about the drug. You can find out effects on bleeding and all kinds of things. And what's happening is that the electronic prescribing companies are then having partners like Lexicomp and hooking into their information. So now you can do, the reason it's called decision support is because now you can see exactly what's going to happen in the dental world depending on the person's conditions when you prescribe that med. And you can see that in black and white. And it goes into a lot of detail. Okay, so these companies are starting to partner up with content companies like Lexicomp to give you the ability to do decision support. Think about medication lists. Think about how powerful it would be. Well, your hygienist, for example, think about having, let's say, an 80-year-old sitting in your chair that's on a lot of medications, not sure what medications they're on, you're about to do a procedure. Well, with electronic prescribing, you're not dependent on just what the patient tells you. I mentioned before that this system will gather information for the past 2 years of medications that a person has been on and they're on presently from all kinds of sources. Okay, and in this case you can see one example of how this is shown. So now all of a sudden at the push of a button you're able to see the medications this person's on. Not only that, can you see the medications, but you see Renew here? Again, this is just one way of doing it. Every e-prescribing vendor has different ways of doing things. But here you can do your refill. You don't have to redo it again. You don't have to retype it in again. You can just do your refill. Okay, very simply. So this is extremely powerful. And again, we're talking about the areas of liability and risk, having this history. Here's another example of how the history comes up. This is just one med, for example, but you can actually choose the period of time that you want to look for history. Here there's just one med again, but look what it shows you. It shows the date filled, it shows the sig, it shows quantity, basic stuff, but it also shows you the provider, who ordered this medication, what pharmacy, what's the source, what's the PBM. A lot of information, very powerful. Okay, so medication histories are extremely powerful, and this is something that is done in all e-prescribing solutions, but as I mentioned, they're going to do it a little bit of a different way, each one. This is something that you're not going to see a lot, but that you're going to start seeing starting actually now and in the future. So patient compliance monitoring. So how wonderful would it be to close the loop, to actually know and put in your electronic record that your patient is on that drug, that you didn't just prescribe it, that it didn't just show up at the pharmacy, but that your patient actually picked it up. Okay, in this case, there is one e-prescribing vendor that has this enabled. Now, if you remember, the SureScripts network, the network that controls e-prescribing, the pharmacies do have the ability. They've had the ability for quite a while to report on this information, to report back from the pharmacy on when things are picked up. It's just that the vendors really haven't incorporated until today, but we're starting to see use of this. Okay, again, as I say, it closes the loop and you're able to see what your patient is on for sure, that they did pick it up. This is a very powerful feature, and you're going to start seeing this more and more. Finally, and again, I'm just putting 6 features down here and 6 reasons why this would help you. If we had more time, I can go into a lot more. But the final one is reports, the power of reporting. We have reporting in a lot of other aspects. With practice management, report on your cash flow, how you're doing. In electronic records, we can report on patients' conditions, your procedures. Well, how about having reports on medications? And I have a lot of practices that have been clients of mine, and they've used e-prescribing reports in terms if any drug has been, let's say, taken off the market or stopped. How powerful is it to type in a report box like this, a drug name that's been discontinued, and then be able to find out all the patients that you have that are on that drug, and you can send information to them, you can call them, do whatever. But how powerful is that? That's one way of using a report that's generated by an e-prescribing solution. But if you look at it, in this case, it can get more powerful. You can actually have a lot of variables. I want to find out all my patients that are pending for prescriptions, that we've completed prescriptions on, that are certain schedules of prescriptions. So you can actually do a lot of reports. You can't do these kind of things manually. Okay, it takes an ePrescribing solution to do this. So really, when you think about it, I've gone over 6 or 7 reasons why you should really think about ePrescribing. Yes, there is not a mandate here today. It's going to be next year in New York and probably in other states as it happens. But again, what should we think about ePrescribing? Really, a lot of people call me up every day to ask about this and other things with software, but especially about ePrescribing. People are afraid it's complicated, it's expensive, it's too hard to do. You have to complete electronic record to do it, a complete electronic health record. And that's not necessarily true. Okay, as I hope I pointed out, there are different ways to deploy this. And so it's important because it takes a while. Even if technically it takes you a certain amount of time to put it into your system, it still takes you time to put it in your workflow. And you're not taking advantage of all the features. So I would really encourage you to look closely, to look at the different ePrescribing solutions, see what works best for you, and then go ahead and take this baby step. Take this baby step into getting more electronic and really look at electronic prescribing. So the other thing I want to mention real quick is on my website, Dental Software Advisor, as well as Dental Products Report, I like trying to keep everybody up to date on things like ePrescribing and other things that are going on with dental software. So I would encourage you to go to the site and look at the information. I do a lot of podcasts, as Andy mentioned. And if you have any questions, feel free to email me, and I'll be happy to talk to you and educate you kind of on where all this is going. So anyway, with that, I thank you all for your time, and we do have a couple